Hi. All right.
Not a couch conversation.
Not a couch conversation, but a chair conversation.
We just worked out and it was great.
It was great. And today we're going to be going over each individual lab process and everything you need to know about completing your labs. There are a total of 4 of them in the foundation protocol. First is urine collection test kit. This is your environmental pollutants test. It comes in this envelope with everything that you need. So when you open it up, the instructions are on this left-hand panel. Inside the envelope, you're going to have another small plastic envelope with a test collection strip on the inside.
All right, I think we're going to be very specific about this because when I took mine, I was unclear about where the urine went and exactly where the strip went.
Yes, we will be very clear for everyone involved. So the process is you need to collect first morning urine, and this is very important. So setting alarms is very important, leaving Post-it notes, leave the test and a clean empty cup next to your toilet. So when you wake up in the morning, you're reminded to do it. So the process is you wake up in the morning, you're going to pee a little bit in the toilet, do a little bit of a void, and then you're going to collect the rest of your urine in a clean cup. Once the urine is collected, this is a dried urine card. You're going to flip open this card, and it's perforated. So you see these 2 absorbent cloths. You're going to put this side into the cup with the urine. Let it get soaked completely. Once it is soaked, you can stand it up. You can make a little stand for that to dry on its own, or the instructions say you can also use a blow dryer if you are in a hurry for whatever reason. You're going to let this stay out until it's dry between 6 to 12 hours. Once it is dry, you're going to fold it up just like it came. On the back, writing your name, gender, drying method, air dried or blow dried, date of birth, and date collected. Once it is collected, you're going to put it back in its plastic envelope, and then it comes with a return label. You're going to place this inside of here along with your filled out requisition form. This also comes in the kit. The places that you need to fill out on this form are highlighted in yellow. It just includes your name, your last name, date of birth, sex, and especially important is the date and time collected. You don't have to worry about the second page. It just highlights the test that you're completing, which is the environmental pollutants profile. That's a great test. Okay, next we're going to be going over your hair test. This is your heavy metal test. Everything comes in this envelope. It comes with a scale. This is what you're going to use to weigh your hair sample to know if you're sending in enough. A collection kit. You're going to fill this out with a permanent marker so it doesn't smudge. This is where your hair is going to go. With a return envelope, postage is already on there. It's prepaid, so you don't have to worry about that. And your requisition form. So this is going to be your order form. You're going to include this in the envelope when you send it back. Looking at this form, you have to fill out the day it was collected, and then selecting, you can collect pubic hair. We strongly recommend you collect hair head. It's much more accurate. And then you're going to include just your patient information down the box below.
But if you don't have the option for your hair on the head, and how much hair and where does it come from? So actually me having a ponytail is probably good to explain because we want to get it close to the scalp.
Yes, if you are doing especially a repeat test, but for most tests in general, the closest you can get to the scalp is better. It's going to be a more accurate reflection of more recent hair growth and more recent heavy metal exposure. If you've never done a heavy metal test, you can be a little bit more lenient with selecting hair that's a little bit longer away from the scalp. So I'll point on you if that's okay.
Yeah, that's okay.
About where we would be taking the sample. So I would take samples from the back of the neck, and you're gonna have to take a few just to make sure you're getting enough hair. So just take a thin size sample. I would do something, and I would probably go even a little bit further up in the hairline so you can't notice it. Something along this size, and because if this is a first time hair sample analysis, you can take this full piece of hair. If it's a follow-up, you just wanna take the part that's about 2 inches closest to the scalp. So we take a few samples from here, here, here. I know it sounds like a lot. It's not scary, and you won't notice.
We'll do one. We'll do another video where we're doing my hair.
So you can see, you're going to put everything on this hair scale.
And so you're going to want to have not a ponytail.
Yes. Yes.
No, it's really not that noticeable.
It's not
noticeable. It will grow back fast.
And if you take it from many different areas, you're not going to notice where that hair was. But in order to do the scale, you flip back these two sides of the black scale. You're going to place the hair sample on the place here circle. When there's enough, the scale will tip down. I encourage people to send in a little bit more after the hair scale does tip. Sometimes if you don't collect enough, they'll give us a notice and we'll have to ship you another kit. So when in doubt, send a little bit more than what you think. Once the sample's collected, you can put it in that mail, in the envelope, and send it on its way.
And you could do urine and hair the same day, for example.
Absolutely.
And
absolutely
get those two checked off.
But this is our last test, or our last at-home test. It's our cortisol panel, comes in this box. So inside of this box, you're going to get a bunch of things. First is your requisition form. This is gonna be the most detailed form you're gonna fill out for all of them because it is a 4-point collection test. So on here, you're going to fill out the date and time of your collection, but the times for all 4 collections that you did throughout that day. So I typically recommend people keep a note on their phones for the different 4 points throughout the day that you took the samples. The timing is really important. And just on the bottom here, you're gonna fill out the patient information. Next in here is a symptom intake form, and it is very helpful to fill this out. It is front and back, so this form is a little bit detailed. It's gonna go through specific symptoms that are related to cortisol imbalances and hormone imbalances.
What did one of our members said? It's like taking the SATs.
Yes, like taking the SATs, and it even shows you. I think at one point on here, like fill the box out like this,
exactly.
Like the full circle.
We've been there before.
We all have some interesting memories filling this out. Maybe do this after your test. And on the back here, you're just filling out if you are on different hormone replacement therapy, melatonin and thyroid medications on there too. So if you are taking those things, make sure you do fill out the back of this form. The instruction manual is in here as well as what we're going over right now. The tubes are color-coded based off the time of day you're going to be collecting the sample, so just make sure you note that you're collecting the sample at the correct time. And then we have a return label that you're going to be putting this box back into and shipping at a FedEx store near you. In with this comes a little cooler. This is what you're going to be mailing back. And in the bottom is an ice pack, so you're gonna put this in the freezer before you take your sample, so it's ready to go when you finish.
So when you get it, what I did is I just immediately opened up the box, put the ice pack in my freezer.
Yeah,
and
exactly.
So
That's perfect.
So you don't forget.
And then this envelope you're gonna want to fill out with a Sharpie just so it doesn't smudge. So first and last name, and again you're gonna want to collect. You're gonna want to make note of when you're taking these collections. The first one in this pink tube is 30 minutes after waking, and that timing is really important. So in the morning, making sure you're setting an alarm for 30 minutes after you wake up to do the saliva collection. The green is gonna be before lunch, the orange is before dinner, and the blue is before bedtime. Ideally, you're collecting these at least an hour before or after meals. And for the one in the morning, you wanna make sure you just haven't immediately within the past 30 minutes brushed your teeth or used any products that were in your mouth. So give it 30 minutes, hang out for the morning, and then go ahead and do that first collection.
Now it's spitting. I don't know if we were that clear. It's saliva.
It's saliva. So this test comes with, there are these little tubes.
Spitting in tubes.
Yes, you
and
are.
And it's okay to have little bubbles. It's all right.
Bubbles count.
They do take a while. It does take a little bit. It's not a 30-second move.
Yes, it takes a little bit of time. These straws are exceptionally helpful. You can use them to help capture the spit into the tube itself. And just like Julie said, the bubbles count. And you're gonna see the actual liquid's probably gonna fill up like maybe half, the rest will be bubbles, and that is completely fine. So once you're done with each tube, you're gonna put that immediately in the freezer, and you can put them all in the box with the cooler when you're ready to ship it and mail it out. So just store them in the freezer until you're ready to mail out all 4 collection tubes.
All right, so then when you are mailing it, we had a question about this, which is, like, could it be in the car for an hour while you're driving to FedEx, or what's the timeline that you've got?
So we want to make sure that the ice pack stays cold. So if you are gonna like do a few stops along the way, I'd say wait until you can go to a FedEx and make sure it's actually staying frozen. If it's like the middle of winter and you're leaving your car, I'm less concerned. So if you can go with FedEx within 30 minutes take it out of the freezer, and mail it, and you're gonna ship it in this box, in the FedEx container.
Yep, in the thing.
Yes.
It's all prepaid.
Everything is prepaid.
Super fun.
Yes, and if you have any questions, their instruction manual is really thorough as well.
Blood work.
Yes, blood work you're most likely going to be ordering through LabCorp, and if not, it will be through Access Medical Labs. We will instruct you which lab site you're going to be going to. If it is LabCorp and you have not selected mobile phlebotomy, you will find a LabCorp site near you. We will send you a link on how to do so, and you can go and get your blood drawn from a LabCorp facility. If you have selected mobile phlebotomy, we will coordinate with you how to set up a mobile phlebotomy appointment for someone to come to your home. If you have an Access Medical Labs kit, you can either do mobile phlebotomy, which again, we will be in contact with you if that is the case, or we will send you lab recommendations for an area near you. The Access Medical Lab kits will be sent, a kit to your home that you will bring with you to an appointment for the blood draw. For LabCorp, you will not receive a kit in the mail. They will do that for you at the appointment site. You will get a lab requisition form, yes, to be able to take with you to the appointment. Well, Access Medical Labs, that's going to be more important. LabCorp typically stores them on hand, but we encourage you to bring them with you regardless. For the appointments, they are fasted, so you want to make sure you're fasting between a 12 and 16-hour window, no more, no less. So typically we recommend people go in the mornings and you fast between 12 and 16 hours overnight. If for whatever reason that lab draw is beyond 16 hours, make sure you're timing it accordingly to the last time you eat, even if that means you're eating later than what you normally do. This is important for us to track your fasting glucose and your fasting insulin and a couple of other markers in your lab work. For females that are getting tested, ideally we're testing around day 3 of your menstrual cycle. If you don't have a cycle or that's not possible to test during day 3, let us know and we will factor that into your lab review.
So for mobile phlebotomy, if you didn't order it and you want it, just reach out to us at hello@revhealth.com.
And we'll get it scheduled for you. We did mention that it's fasting, but water and herbal tea is okay before the blood draw. You do want to make sure you're pretty well hydrated, but no caffeine or coffee.